Okay, we're live.
Do you not do the blurb?
Do you want me? I'll do it, Ben. Okay.
Yeah. Okay. Yeah, if you could.
Okay. Thank you for logging on to this Zoom video conference of the Safer and Stronger Community Scrutiny Committee. I am the Democratic Services Officer for this meeting, and I'm assisted by my colleague Kate Sheldon, who is the host of the virtual meeting. We will proceed to introductions and housekeeping in a moment, but just a couple of points to note. This meeting is a public meeting and, in alignment with the new regulations which permit meetings to be held by remote means, will be live streamed for the public to view. To make the meeting run as smooth as possible, and I please ask that participants in the virtual meeting room to leave your microphone on mute when you are not speaking. When you want to speak, please raise your hand to the camera, only unmute when the chair indicates that you can speak. If at any time any member loses the ability to hear or be heard, they must alert the chair or host as soon as possible. You may see members looking to the left and right of their screens. This is because they may be looking at an additional screen or device containing agenda papers, not because they are distracted. I will now hand you back over to the chair of the meeting. Thank you.
Thank you, Jenny. Right, in terms of welcome, I'd like to welcome councillors Dagnall and Wilson, who have been appointed onto our scrutiny board, so here for their first meeting today. So welcome to you both. Good to see you. In terms of apologies for absence, I've had an apology from Paul Wood, who's had to make a trip to hospital, says he might be back in time, isn't quite sure, so he may join us later, but to note his apologies. Were any other apologies received?
No other apologies, Chair.
No. Okay, right, there's no items for the exclusion of the press or public. Do any members have any interests to declare?
Chair.
No?
Yeah,
oh, yeah.
Chair, sorry. I'm a trustee of the Ben Centre, and I believe the Ben Centre CEO has been invited to the meeting. Thank you.
Okay, anyone else? No? Okay, so minutes of the previous meeting, can we agree that they were an accurate record? I'll take nodding as affirmation. Thank you. Are there any matters arising that anyone wants to raise from those minutes? No. Oh, Andy. Councillor Sanger.
Thanks, Chair. Sorry, I thought you might go page by page. So the almost the last page. So page 17, the work programme, item 7.2. We did resolve to have an additional meeting in April to enable to receive an update on the housing repairs service. I don't see that in the work programme that we've got today on today's agenda.
Yeah, we don't have a date for it yet. It will happen. I've spoken to Councillor Wood, who's determined for it to happen.
That's great news.
Well.
That's great news. It was just that this morning we'd been told that we couldn't have lap meetings in April, and I just was checking that we've always in the past had scrutiny meetings in April.
Yeah.
Excellent. Thank you very much.
Yeah. As far as I'm aware, there's no ban on scrutiny in April. Yeah.
Thank you, Chair.
Yeah. Okay. Emily, do you want to?
I was just going to note that the advice in the past has always been that scrutiny can go ahead in April, but that just to note that we will be in perp at that point, and we might have to factor in. I think guidance is usually issued for how to manage a scrutiny meeting in that period, but it shouldn't be a problem. And I'll make sure that a date's in the diary as soon as possible.
Thank you, Emily. Any other matters arising? No. Okay. I've not been notified of any public questions or petitions. Have any come in late? No.
No.
Right. Okay. Well, in that case, then we'll move on to this substantive item of homelessness and rough sleeping. I thought if I passed over initially to Suzanne Allen, because her name's on the report, and then when she's finished, we'll move on to the other speakers. Let them make their contributions before we move on to questions from councillors. Okay, so Suzanne, I'll hand over to you.
Yeah, thank you. I'm here as the head of Citywide Housing Services for Sheffield City Council. And what we've done is prepare an update report on homelessness. I understand the committee is also particularly interested in rough sleeping. I chair our multi-agency response to COVID-19 crisis around rough sleeping as well. So what we've done there. And actually what I'm going to do is very quickly hand on, if it's okay with you, Ben, is to the author of the report, is actually my colleague, the service manager, Zoe Young. And she'll, obviously we hope that people have had a chance to have a look at the document, but we will draw your attention to relevant points. And then if it's okay, if there's any questions, both myself and Zoe can help answer those. So I'll hand over to Zoe, who's actually written the report. My name's on it, but I'll acknowledge that it's Zoe's work. Thank you.
Thanks, Suzanne. Hi, everybody. Thanks for seeing us today and bringing this item forward. It's really useful. I know that you've all got the report, so I will, as Suzanne said, just bring your attention to some of the issues in the report and the main points, and then we can answer any questions. What I've based it on is the response to the COVID-19 pandemic and homelessness, but I've looked at homelessness in general, so not just rough sleeping. And I think it's important to note that homelessness and rough sleeping, so that the rough sleeping part of homelessness is just a small percentage of the work that we do in total. And normally people who come to us asking for help because they're at risk of homelessness or are homeless find somewhere to stay or go into our temporary accommodation and don't end up on the streets rough sleeping. But obviously rough sleeping is the most visible part of homelessness, and I'll go on to that later on in the report. So as you can see from the report, we've had since March 2020 and COVID-19, we've had a significant increase in people that we've accepted that the council has a duty to actually house. And that's meant that there's been a significant higher use of hotels and bed and breakfast accommodation and temporary accommodation. Now, the increase use of temporary accommodation has changed a lot, and we think that's probably because a number of people are not staying with family and friends at the moment due to the pandemic. More people need their own accommodation, and when we talk to our customers who ring us or come through the door, the things that they're saying is we can't possibly live with friends and family because of the pandemic and the rules around lockdown. So we've worked collaboratively to provide emergency accommodation and wraparound support to people at risk or found to be at risk of rough sleeping. And that's something that we continue to do, and that's all in the summary of the report. And we have as well had an increase in people who are rough sleeping in the city. At the last year's count, we had 29. This year's count, that had gone down, but since COVID, we've placed over 196 individuals in emergency accommodation who have actually said that they're rough sleeping, and we've assessed that they are or at risk of rough sleeping. Just to sort of a caveat on that is some of the people that we have placed in emergency accommodation are also people that have had no recourse to public funds, and historically we haven't legally been able to place people with no recourse to public funds. We've also, it's been winter as well, so on top of everything else that we've been doing around homelessness, rough sleeping, we've had a winter plan that we've put in place. Now you all know, because I've been and spoken to most of you before, that we usually have a severe weather plan where if the weather gets below zero, we provide accommodation. This year we've done that slightly different for lots of reasons, and we've not relied on what the weather is like to place people. So anyone that we found that were rough sleeping or at risk of rough sleeping throughout the winter months, and that will go on until the end of March, we've provided with some very quick access temporary accommodation. Lots of reasons behind that. If we just place people when it's cold, they were at risk, public health risk, they couldn't socially isolate, and also a lot of the day centres, and I'm sure Tim and Daryl will talk to you about that when it's their turn, have had to change the way that they work because of COVID and social distancing. We've also, and you will know this from the report, we have our prevention strategy, which is due for renewal at the end of this year. And from that, we've got a number of forums and groups that we have set up. So we've got our Homeless Prevention Forum, which is worked really well, and we've got over sort of 70 organisations at any one time that's coming to that prevention forum in the city, and we're working through different topics across the city to look at our strategic vision for homeless prevention. We've been concentrating on families at the last meeting, but as part of that forum, we've also got a steering group, and we have lots of subgroups. Rough Sleepers one around education, training and employment for homeless people, one around health, and one around the BAMER community, to try and open up our services and make sure that all our services in the city for homeless people are accessible. Just to say that we're working really closely with our advisors in MCHLG and Homes England to try and deliver some longer term housing options and support for rough sleepers, as well as homeless people that come to us as part of the exit strategy from COVID-19. And we've also submitted an expression of interest for funding from the Changes Futures programme, which is a fund that the government have just announced that is support for the most complex people that are affected by homelessness, domestic abuse, substance abuse, mental health issues, criminal justice, and all of those factors put together makes that person need the most intense support, and that is wraparound support as well, I should add. Just to go into a bit more detail around homelessness, the projected number of homeless acceptances at the end of 2021 is 600, and if we compare that with last year, that was 484. Now, being asked to leave by family and friends is still our biggest reason for homelessness, but it's worth noting that the amount of people that comes to us that say that they are suffering domestic abuse has increased significantly since COVID. The number of cases where people come to us because of the ending of private tenancy has gone down, but since COVID, there's been no evictions from tenancies. So we're expecting, once that has changed, that the number of people coming to us could increase, and there is a bit of a risk there that may happen. We've also had a number of people, or an increased number of people come to us who've left an institution. Now, that's mainly prison, but there has been other institutions where people have come to us. That could be somewhere like drug rehab or mental health rehab. We've got an increase in single people that have come to the service from about 71 to 75%, and we're a bit of an outlier with all of the local authorities, because a lot of other local authorities have got a lot of high percentage of families coming to them, but in Sheffield we have a lot of single people, and it's usually single males that come to us. So temporary accommodation, I'll move on to that. As you've seen from the report, there's been a significant increase for demand in temporary accommodation, and we have made quite a number of placements into bed and breakfast and into hotels. I think it's really important to look at, sort of compare the figures this year with last year, and there's a table in the report that shows you that. But I think that the most significant number is that if we look at a snapshot made between March and December 2020, compared with the same number in 2019, we've increased from 284 to 389 households, which is over 100 households more. Some of that is to do with the Homeless Reduction Act that came in, because we now have to work with people for longer. So we have 56 days where we have to try and prevent homelessness or relieve it. So relief means find a family or an individual somewhere else to stay, and they're staying in temporary accommodation for longer. But some of this is to do with the number of people that have presented to us and we've accepted as homelessness since COVID-19. We've done a lot to try and help the increased demand in temporary accommodation. We've prioritised people for general needs housing. We've got more dispersed units that are our own stock that we're using. because we really want to reduce the amount of people that we've got in hotels and bed and breakfast. Obviously, we all know that hotels and bed and breakfast is just not suitable for people to stay at any length of time. And we want to cut that down, so that's just an emergency. Before COVID, I can tell you before sort of March the 26th, we had about 17 people in bed and breakfast accommodation, and that's gone up considerably, including the people that we've got in winter plan. We've got about 170 or just over today. So it's a huge significant increase that we don't want in the city. So I know that you're interested in the work that we've done around rough sleepers and the COVID response, so I'll move on to that. So on the 26th of March, and that date's sort of embedded in all of us, I think now, the government asked local authorities to undertake a number of actions to support young people, and that was with immediate effect. So it didn't give us any building time. It was just on this day, you must get anyone that's at risk of rough sleeping or that is actually rough sleeping inside and with an emergency bed. One of the things that they asked local authorities to do was to set up a cell group, and that was to oversee the city's activities to support rough sleepers. We set up that cell group very quickly. Suzanne, who's just spoken to you, chairs that group, but we have got senior members from housing, care, health, public health, the police, commissioning, and we've had really good buy-in from public health and the CCG as well in that group. We met every week over the lockdowns, and we're actually still meeting monthly now, because some of the partnerships that we've built up within that group, we want to continue across the city and also do a lot of learning from that, because the way that we've worked over the pandemic and the way that we've worked as a partnership has meant that we've been able to do a number of things jointly across the city. So the cell group does work really closely with all the homeless prevention strategy groups, and also we have a number of subgroups from that cell group, which Tim, Daryl, Tracy are all involved in, and Maxine that are here today. And those groups are about health. We have an operational group, we have a community safety group, so that we can be really clear as a city what our response is, what our exit strategy out of the hotels and that accommodation is, but also going forward what we can learn from it, and how we can follow our strategic aim, which is to make sure that as a city we don't have people who need to sleep on the streets, and also we can prevent homelessness at the earliest possible opportunity. So the other thing that government talked about was support for rough sleepers, and that was something that we put in place really quickly. So all the day centres, we've got 2 here today that we'll talk to you, soup runs, other support systems for rough sleepers, really had to change the way that they ran during the pandemic. So day centres couldn't have as many people in there, couldn't do the work that they did. The soup runs couldn't do that. So everybody's sort of work together to work differently so that we can support rough sleepers across the city. We've had things like Meals on Wheels runners with the Arch Project and Ben's. We've had people picking up rough sleepers washing from hotels. It's been really inspiring, the amount of work that's happened through the charities and the council through COVID. So also, the one thing that people want to know about really is about the procurement of the accommodation for people, the emergency accommodation. So very quickly, we had to find somewhere to place the increasing number of people that came to us that said that they were at risk of rough sleeping. So you're probably all aware, I know I've spoken to some of you before about some issues around the accommodation, but we did find a number of hotels in the city centre where we've placed people. Now it wasn't easy to do because each of the hotels people had to have private bathing facilities because of the public health risk. We started off by using 4 different blocks of accommodation, but because of the work that we've done to move people on, we're down to 2 hotels that we're using at the moment. We block booked the hotels, and one of the things that we needed to do was to make sure that people didn't have to use the streets, come out onto the streets and congregate or do anything really that put their health or the health of people in the hotels or people working with them at risk. So whilst people have been in the hotels, we've managed to do wraparound services that are actually going into the hotels. So we've got a street outreach nurse that's going into the hotels. We've got hepatitis C nurses. We've got drug and alcohol services. We provided people with 2 meals a day, a laundry facility, and we also helped to find people some meaningful activity so that they had something to do during the day. Now, we've had some real successes from the work that we've done with people in hotels working in that way. We've had people that have got jobs or have joined social enterprises, people that have moved on and are still sustaining their accommodation and not moving out on the streets. And we did a consultation with people in the hotels earlier on in the year, and some of the responses we got from the consultation, and that was a face-to-face consultation, has helped to shape some of the things that we want to do in the future. And I'll talk a bit about Housing First in a moment. So basically, we've still got 17 people left in the hotel that was part of the Everyone In campaign. Every single person that was put in the hotels was given a support plan and an exit plan of their move on and their housing options. We set up a multi-agency panel so that each person could be discussed at that panel, and some wraparound support could be in place and coordinated properly, so each person got their own support. Now, from some of the work that we've done, some of the evidence that we've built, and also some of the consultation responses we received, we decided that we would repurpose some money that we had in our RSI budget that we were going to use for a safe space. So the safe space was going to be in partnership with the Arch Project, and it was a communal safe space where people could go during the night, get help, get support. But obviously, as soon as the pandemic hit, that was a no-go and we couldn't do that. And after the work that we'd done and talking to partners and to service users, it was felt that perhaps one of the things that we should do as a city is set up a Housing First programme. So Housing First is something that's nationally or internationally renowned model for working with people who are homeless, and it's about providing people with their roof first, basically, and saying you have to provide somewhere to live before you can start putting all the support in place. It's also Sheffield model, so that it's a multi-agency model. So it's run by the local authority, but all our partners have bought into this and are supporting us and helping us. So we got the go-ahead from MCHLG to do this, and we are using our own properties with some very, very, very intensive support. So each of the key workers only works with 5 individuals, which as you can see from that's really intensive, and we're having some really, really good results from it. Just to say that one of the other posts that we put in that team was a mental health nurse, and that's proved really invaluable to us. So we are actually, a mental health nurse is going out to people's properties and actually doing mental health interventions. But not only that, but she's wading her way through the mental health services to enable us to get people into treatment faster. That's also the same with people that need drug and alcohol support. We've got services going out to people rather than people having to go to appointments, which because of the nature of the customer, they just can't keep. The other thing that we've done is a lot of work with DWP around making sure that anybody who goes into our housing first, their income is maximised as much as it can be, and it's fast tracked to stop people having to go out and continue doing their street activity, begging or committing crime. We started with, we say that we're moving people in slowly. We're working with people on a housing first model, the people that we've identified, even if they're not in their property, and we're moving people into their property slowly. We've committed to 30 units, but we hope that we will increase that if we can get some extra funding to do so. I'll just touch on the winter plan. I've touched on it already, but just to say that that's the scheme, it's replaced Weather Watch. It's come from, it starts in October, ends in the end of March, and it's providing a bed for the night, well, indefinitely really, for anybody who is at risk of rough sleeping or is found rough sleeping. What we do is we've got staff working in those hotels every single day, 7 days a week, and anybody who goes in there firstly has an assessment with one of our workers and a plan built up around move on from the hotels, because we don't want people staying in there for longer than they have to. But also we have a health assessment as well, so that people get the proper health support that they need, and we can categorize that into low, medium or high needs, particularly at the time if anybody needed to shield, we were able to do that in the hotels. Moving on from the hotels, we've agreed as a city and all the local partners that hotel accommodation is just not suitable for long-term housing. And there's also a risk that as lockdown eases and the economy gets going again, that the hotels that we're using will want to use their beds for other things. I know a lot of the hotels that we have used in during COVID have used to use them for construction workers and things like that. So we're working really hard with people placed in emergency accommodation for move on plans and an exit strategy for each person. We have established a new pathway for rough sleepers in the city to reduce the number of accommodation moves. So we don't want people going out of emergency accommodation and then into another emergency accommodation into supported. We want people to be assessed within emergency accommodation and then move on to an accommodation that's suitable for them. One of the things around housing first, one of the principles is about choice and control, and that's giving the service users some choice, because they're more likely to sustain accommodation if they have some choice in that. We've got the multi-agency panel, which I've talked about, to agree the housing and wraparound support, and the cell group have committed to continue to oversee the work with rough sleepers and the emergency provision, and to ensure that as a city, all the people in the city that are working with us, we're on the same page and we're moving forward strategically to try and prevent homelessness and prevent people having to go on the streets in the first place. I think that one of the things to say is that anybody who's sleeping rough at the moment, and we have seen our numbers decrease significantly since we've been putting people into accommodation. There are a number of people that have had a number of placements and have either left of their own accord or because of their own behaviour. And our view is that we just need to keep working with people until we find the right option, because obviously if we put that person somewhere and they don't sustain it, it wasn't right for them, and we need to move that on. And I think it came across really strongly in the consultation about people saying, when we place them in hotels for the first time, I've just felt like a normal person, with some of the comments. We also got comments like, it's really good that I don't have to go into town on a Saturday or a Sunday, because if I do that, my dealer gives me an extra bag, and basically I'm hooked again, and I don't have to do that. And some of the biggest thing that came out of that was just having services being taken to them, and they felt like they were being listened to. And one of the things that we want to do, and Tracy will talk more about that, is around service user consultation and getting people with lived experience to help us shape the way forward for homeless people and for rough sleepers. And I'll leave it there so that you've got time to ask questions.
Okay, thanks, Zoe. So I'll propose we move on to the other contributions before we take questions, simply because if we have a speaker and then questions, we'll probably struggle to keep to anything resembling a reasonable time, because I'm sure we'd, in an ideal world, have lots of questions for everybody. Maxine, do you want to make your comments next?
Thanks, Ben. I think my comments may be the shortest here, because I chair that subcell, the community safety one that Zoe has mentioned, and we in community safety have put an additional resource into working alongside Suzanne and Zoe's services, but for the community safety point of view, sort of tackling, helping to tackle the rough sleepers, but also understanding that vulnerability and risk that a lot of these customers have. So Tracy is leading on that. So I've just come along, and I can pick up any questions later, but I think for me it's just handing over to Tracy. Thanks, Ben.
Okay, Tracy, do you want to come in?
Yeah, evening everybody. As Zoe mentioned, we did, you know, I'm trooping over at the moment to Community Safety Partnership, but in my former post in Substance Misuse Services, I chair Sheffield Recovery Forum, which brings together people with that lived experience. Hence why I jumped at the chance to get involved and support Suzanne and Zoe in doing consultations in hotel. It was brilliant, best part of COVID for me. It's what's interesting, and I think what we can bring to the table, you know, being a part of Community Safety Partnership, is, like Maxine said, is understanding that antisocial behaviour and the stuff that comes with substance misuse and multiple people suffering multiple disadvantages. Is getting their voice heard and having some meaningful conversation, you know, consultation with them and engaging in that. So the consultations in hotels, well, for me, was the first part of doing that. I'm still in contact with a couple of chaps who were part of them consultations. So you know, we want to continue that conversation. But I think nationally as well, this fits in quite, you know, nicely with national picture. In May 2020, government appointed Ed Day as National Recovery Champion. Years ago, when I first come into working in substance misuse field, service user involvement were really high on the agenda, and there were resources, you know, to help develop that and what have you. And it died a little bit as resources got tight, you know, got tighter and tighter. The focus was then on treatment. But Dame Carol Black's just done, you know, over the past year, been doing some research into, you know, reviewing the National Treatment Survey, you know, the treatment service and what have you. And he's been working alongside her. And I've said this because it is relevant to this work that's taking place that everyone's talked about. So Sheffield's quite ahead of the game, I think, in terms of engaging people with lived experience. Yesterday, the Recovery Forum, what we've done during COVID is, like everybody else, everyone running around like headless chickens. Who's doing what? How can we keep up with service users? You know, how can we make sure they're being looked after and safe? So, you know, like Zoe said, the likes of Archer Project and Ben Centre and St Wilfrid's really jumped, you know, got their heads together. You know, we're meeting twice weekly, looking at how to meet them needs of people who might have been displaced because of COVID. One of the Recovery Forum that I currently chair, is we've widened the membership of that. It used to be you know, just people who were affected by, you know, whose lives have been impacted by substance misuse. You know, we've got a wealth of mutual aid and peer-led support groups in Sheffield, a really big network. But we've broadened the membership of that in recognition that, you know, the same people who might have suffered from, you know, experienced substance misuse problems have also cycled in and out services such as mental health services, homelessness services, you know, been through criminal justice system. And they've got a lot more than just their substance misuse story to tell, a lot more lived experience to offer us. So in terms of the partnership, and working under, you know, as part of this piece of work, what I'm really keen to do is get that lived experience and that voice and get people involved, because there is a wealth of people who really, really want to give back and give something back, and they are doing tenfold, but for many, they don't know how to do that and get involved. So that's a big aspiration as part of my work, and, you know, just to reassure you that, you know, service users are at forefront of planning and everything that's been put together. That's all I wanted to say, I think.
Okay, thank you very much, Tracy. Darryl, do you want to make your contribution next, please?
Hey, hello. Excuse me. So as Tracy said, a lot of different agencies all came together. And to be honest, for me, that's one of the most positive things that's come out of the last year, is the fact that we've all been able to get on the same page, coordinate what needs to be done for who, and try and be creative and figure out how we're going to do that. So for Ben's Centre, obviously in our sort of premises a year ago, we didn't have enough space to let anybody through the doors. So what we did is we become a donation centre, where we would provide all kinds of sort of enrichment items, toiletries, clothes, TVs, even anything that we could gather to send out to people that were being asked to isolate, because obviously the kind of clients that we deal with aren't necessarily going to stay in a flat and be happy for 12 months. So we sent out anything we could to try and make that as comfortable as possible. We devised a little magazine that was full of sort of puzzles and activities to try and get people interested as much as we could in you know, being looked after. We worked together with Arch Project, St Wilfrid's, Hark, Soup Kitchens. We helped to coordinate some of the food that went out. We shared our resources, so things like, I don't know if anyone's aware of Fair Share, where we sort of, yeah, a few nods around the room. So yeah, Fair Share comes in, instead of going to places where we couldn't use it, we shared it out to Tim at the Arch Project, who was sending out the Meals on Wheels. Everyone basically got their resources on the table and figured out where to send them. That's still going on. We're not meeting as often, but it's just been a really good positive approach for me. We've now all been getting clients vaccinated. Let me think, what else have we done? I think that's it really. We've all worked together. We've worked together with Hast, who have been going to the hotels. We've got somewhere to ask questions. I think that's one of the main things. We've got a committee now where we can say there's a gap. How are we going to fill it? And we've got the people with the resources that can fill it.
That's great. Thank you, Darryl. I'll pass over to Tim now. But before we do, I know it's a few months ago now, but I just wanted to say congratulations on your BEM medal, Tim. I'm often skeptical about these sorts of awards and some of the people that get them, but having worked with you for over a decade, I can say it's well and truly deserved. So deep congratulations from me, and I'm sure the whole committee would share that sentiment.
Thank you for that. I've said to a few people, you know, it was given for a combined response as far as I see, and so I'm happy to lend it to Darryl for a few months and to Tracy for a few months and to let it go around the circle. Really, I'll keep it, of course. At the end of the day, that's not the honour. I've got 5 things really to say. Firstly, that from our perspective, looking at what the housing team within the council have achieved in this last 12 months, I think we have to say is pretty spectacular, really. The problems that we faced this time last year and the innovations that have been put in place within that year, I think need to be applauded. So the getting up and the establishing of the Housing First team, the finding of 30 properties to look at, the intention to increase that to 50 properties, the adjustment to a new winter weather provision. You may not know as councillors, but the reports going around the country about how we'll cope with winter weather all through last summer, with the expectations that combined shared space couldn't be used, and how would we cope with that. This winter weather plan is a much improved winter weather plan on previous years because of what it does for the individuals. And if we can keep that going forward, I know that's finance related, but it is so much better. And the way that services have been brought together to work in the hotels, the results coming out of that from our perspective, from what services working at the front line are seeing in terms of the way people are supported with mental health, supported with treatment services and so on, has been absolutely wonderful. So they need to be praised for that. I think I just want to change paragraph 4.2, the first paragraph. We did stay open, and actually we increased to a 7-day service as day centres throughout COVID. And although that was physically the Archer project, really it was a collection of services making that happen. All of the voluntary sectors, including some of the soup kitchens, working together to make sure that there was a contact point, and this is the really essential point. Whilst people were going into hotels, some people were leaving hotels very quickly. There was an adjustment period about how do we work with this really complex group going into hotels. So some people were leaving very quickly. Some people felt bullied out of those hotels by other people using hotels. And some people were just not used to that sort of environment. So that essential contact service still needed to be maintained, and it was. We also realised through that the use of places like bed and breakfast accommodation, which is normally a temporary accommodation, there was competition to get into hotels because actually you get better service in the hotels. And we were dealing with some of that and feeding that back, looking what is a longer term better solution that Zoe's already talked about decreasing the number of places that rough sleepers go to in terms of that pathway out of homelessness. And that was fed back as well within that COVID period. The contrast with hotels made it something, and made it a talking point that it hasn't previously been. And so, for instance, 2 good meals in a hotel rather than just breakfast in a bed and breakfast, that's a real change. Or access to televisions, so some sort of comfort of a sense of a home rather than just a shared room and things like that. That came out of that. The other thing really is the complexity of the group. We've always known it's a complex group, but when you're in a COVID situation and you've got people who are prepared to stay on the street, to ignore any restrictions about distance, face, touch, and all of that sort of stuff, shows the complexity of the lives those people are leading, really. And it underlines for me the importance of the Changing Lives Fund. And if the Changing Lives Fund doesn't come about, the need for that work anyway. And some of the people we're still dealing with at the centres, at that front, are those incredibly complex people. Now, out of that has come some really interesting communication work. It's highlighted the need for better communication. So do we know what people are in accommodation? Do we know why they've left accommodation? Do we know the circumstances? All of those things. And how do we as agencies work collectively to try and answer some of those issues? Because they're not purely accommodation issues. If one person is walking around a hotel with an axe, it's understandable that that person's going to be excluded. But how then do we work with mental health services, with contact services, which is what day services really are, with routes back into accommodation, with support for that person in terms of their health contacts and all those sorts of things. And we've seen those communications grow during the year. But some of those communications are really quite informal, and it'd be interesting to see how we make a better platform for those communications going forward. And then finally, I think as Darryl has sort of alluded to and the others, I've come out of the year thinking that actually this sector is a really can-do sector. And I think we've proved that, voluntary sector-wise, working together, dropping barriers that have originally divided us, although actually those have been dropped for a long time, but COVID helped us just to kick them away altogether. So engagement has worked really well on the street and throughout the city. Collaborative work has been extended and has worked across a whole range of disciplines with an enthusiasm and a determination to work, and that can't be lost. Health delivery. If we look at places like Devonshire Green surgery, working with other surgeries to make sure that health delivery happened for that rough sleeper group, and we've got vaccination service or testing services working to make sure that that group is taken care of. Again, that's wonderful. And as I said before, the speed of developing new responses and putting those innovations in, that's really showed we are a can-do sector. So thank you very much.
Okay, thank you, Tim and everyone for your contributions. And we'll now move into questions, and I'll just take them in the order that I've received them. So, Councillor Dale, do you want to go first, please?
Thank you, Chair. First of all, I would just like to thank each and every one of you for all of the work that you have done over this last 12 months. I mean, it's astonishing that what has happened and the impact that you will have had on individuals. I know Tracy gets phone calls from me regularly with concerns with regards to, you know, people at city centre and all that sort of stuff. And all of us here are really concerned about, you know, people's health and well-being and their lives and impact that their lives have had on them, really. I have got a couple of questions, really. One around the council's commitment to 30 units with the plan to increase that to 50. I'm just wondering what considerations were taken when are these in specific areas, or are they pepper potted across the city? Because my concern would be housing potentially very vulnerable people in areas which has got cheap housing, which they may then become targeted and not be able to move on from that lifestyle, really, because that is one of the things for me. And again, just applauding the VCF sector. You know, I will always advocate on behalf of the voluntary sector. I'm from the voluntary sector myself, and you know, we all know that collaboration and cooperation is always the best way, really, and it is about the impact on the people that we're working with and for, really, that why we do it. So thank you. But that was my key question. It was about the consideration around where we're going to be rehousing people. Thank you.
So who wants to take that one?
Should I respond to that one? Sorry. Yeah. So you're quite right, Dawn. What we don't want to do is set anyone up to fail or overly concentrate very vulnerable people in a specific area. So the initial 30 properties are council properties that we're identifying. And what we do is we don't just say it happens to be these 30 properties. We're finding the right home as far as we can for those individuals. So we've done a joint assessment of need with all of the partner agencies, which covers housing, health, any community safety concerns, mental health, any recovery issues around drug and alcohol and so forth. Have they had a poor experience in a particular area before, so it's not going to be a good start for them? And we have, between us, all the agencies, we've now got a rehousing panel that looks at those vulnerable issues. We then have, through our property pool, we have a look to see what homes might be suitable and work out what the right one is for that individual. And we don't force anyone into anything. It's about, this is what could be, what do you think about that? and what package, what support do you need to make that work? And the thing we've done differently as well about this, because we so want this to work, we've said that, so on the Housing First, they get one-to-one intensive support from a key worker, as well as all the agencies coming in. And we're continuing the support they've had in the hotels into that new home. So the mental health services, for example, whatever package they've got, that goes with them. We're then constantly reviewing how that person's getting on. So we don't just put them there and forget it until there's a problem, because that's something that can sometimes happen. You set off with really good intentions and then you're on with the next people. So basically, the other thing we've done as well, as you've said, Dawn, we need to make sure we've got an appropriate range of homes. We've also asked our partners in registered provider sections, so housing associations, for them to make properties available. So not everyone will be concentrated in council properties. For some of the people that we're working with, it may be that a private tenancy is more appropriate for them as well. Now, that's not going to be the usual route that we're taking at the moment, but for some people, estate type living just isn't right for them at this point. So it may be that they need a different home. So we're completely aware of what you've said. And the other thing I will say, and Tracy helped us enormously with this, we actually asked people what they wanted and what they thought might work for them. And our target operating model has taken into account what people who are actually rough sleeping said and what they wanted to happen to reach there. And I think this is, really, and everything that people have said, these are humans, these are individuals who've got a whole life ahead of them. And it's about their life plan, their goals and aspirations. It's not just about getting a roof over someone's head, you know, for a crisis. So I think what we've all done, and I'll echo what everyone said about the partnership work, for me, it's been transformative, it's been brilliant. And I just want to build on that so that the people, the residents of Sheffield, who are both impacted by these issues individually, get a better chance at having a successful life going forward. We prevent things happening, so we're not dealing with crises, but also, and I think, you know, some of the councillors are here who've been really supportive as well. We know there's a community impact as well if you've got groups of people living with high needs in a particular area, and we don't want that to happen either. So to me, I want to get away from the hotel model, but take all the benefits we've had of working together collaboratively. So I hope that satisfies, Dawn, that we are doing those proper checks.
That's great. Thank you, Suzanne. Can I just ask one last question, please, Chair? And it's just around the commitment. So it's just about the commitment to the continuity of Housing First. You know, this has grown out of COVID, really, and the urgency as a response. Are we happy that this will continue? Do you feel that there's the commitment there for this to be the model that we continue to use? Okay, so the funding is an issue, but what we've done, and so we've led on this conversation with government on it, we've said we want to continue this model, we're committed to it. And they're very positive about that being one of the tools, one of the options that need to be available for people who've got very complex needs. So we're pretty confident that some of the rough sleeper funding we get, we will be able to take that forward to use that. The other side of it is all our partners, including the ones in the room, are committed to it as well. So we're quite confident that if, you know, it stacks up, and we believe it will, in terms of the benefits to people, financial and other benefits, we will make it happen somehow. And that's the point, really. And I think for me, you know, you can say, well, there's this cost to it, and it is very intensive support, but there's wider costs if we don't have the right housing options available. And that, to me, is one of the things that I think, and others will say, you know, if I think I'm right on this, that our partnership understanding, that holistic understanding, Maxine's here, you know, with community safety head on, the work we've done with police, for example, partners, has been transformative, really, about saying we've got to do it different. So we are going to be investing lots of resources anyway. Let's just make sure we make the best use of them. Thank you.
Okay, Councillor McGowan, do you want to ask your question, please?
Yeah, thanks. Dawn's just asked one of mine actually. But thanks, Dawn. Just wow, fantastic work that's been done, and thank you every single one of you. It's been fantastic. It's really good to see something good come out of COVID. I think it looks like it's been a fantastic opportunity to do this intensive piece of work that we might not have had an opportunity to do, and for what Tracy's done, talking to one-to-one and having a proper real understanding about the issues. You probably never have got that opportunity without all the lockdown. So yeah, brilliant. So it leads me on to thinking, so what after lockdown? And I'm just trying to get a feel for what's it going to look like then, and are we going to see people back on the streets? Because that was the concern before. Do we think, and basically, do we think we've cracked it with this? I'm just trying to get a visual, you know, it sounds great. And how what's going to happen? And just one final question was, I think, Zoe, you said that single people, it had gone, it was mainly males, where in other cities it's been families. And I just wondered what you thought the reason behind that was, and why we were different to other cities.
Zoe, do you want me to respond, or do you want to? Okay, I'll respond. Okay. Yeah, so the after lockdown, and let's hope for all our sakes it is the final stages of this, because it's been awful for everybody, hasn't it? What we've got is an exit strategy that we've agreed with all our partners, which it doesn't say it's just a one-off, it's how we build on that and how we take all that work forward. So how do we do the right learning? And so the panel I mentioned on complex needs, that's in place now. It's not just about housing first, it's anyone who needs a new home or needs help to stay where they are, but we realise they've got a lot of complex needs, and we're taking that forward, and all the partners are committed to be part of that. So that's one thing we're practically doing. The other things we are doing is, as Zoe said, we've got our strategic group that looks at homelessness more widely than the rough sleeping element, because rough sleeping is the worst manifestation. We don't want people to reach that point. We want to prevent it earlier on. So what we're doing is we have a huge action plan associated with that, which deals with the collaborative working, support to the most vulnerable groups, housing options, so making sure there is the right provision, and also making sure we look at those deeper things, the health issues, education, employment, training issues that people have got, and building the prevention with agencies who are working with people before they get to the homeless service. So post-COVID, we're not just going back to business as it was. We're not going back to that world, so we're all committed to that. But practically speaking, there are challenges for individuals from what's happened during the pandemic. There's economic and social impacts that Zoe's spoken about. So things like increases in domestic abuse, for example. We do expect there may well be an increase in evictions from private rented properties once those temporary sort of stay on evictions been relaxed. And we're preparing for that. So what we're doing on the rough sleeping side, and I think you specifically said, did we think that would increase? It is there. We can't say it isn't there. And what we're trying to make sure we do is, you know, we were really disappointed that we couldn't get down to zero rough sleeping in Sheffield, because our numbers are relatively low on rough sleeping. So the last count was 25. Now that's not good, you know, on any one night, that isn't good, but it's not the 80, 90, hundreds that other core cities have experienced. And what we're saying is we still want to get down to naught. So how do we do that? How do we make that happen by having the right options? And I think for me, what we never give up on people. We keep going back with what's the right thing to do. So I do think there's risks, if I'm very honest with you, that homelessness will increase because of the wider things that are happening. And we all know about issues for council budgets, partner budgets, and so forth. But what we've got to make sure we do is make the best use of the resources we've got. So it's part of a strategic approach. We're not just sort of leaving it now, but actually we're saying what we're going to have to do. And Zoe mentioned it earlier on. We have got the homeless prevention strategy, which runs up to the end of 2021. And we're starting work now on what do we need to prioritise to make a difference in this new world.
you want me to come back on the question around families and why I think there's more singles?
Oh, right. Sorry, I forgot about that. Yeah. So if you explain that, because we've looked at this. Yeah, definitely. Sorry.
Yeah, I mean, we have the individuals that come to us that are single, and I just want to point out around women, we don't have that many women that are rough sleeping, but the women that do come to us that are rough sleeping are extremely vulnerable, and we have to make sure that we've got some additional support for women that come to us. In Sheffield, we do pretty well with families. Our preventions are usually with families. So when people come to us in a family and they say, you know, I've got nowhere to live, or we've got some help, we need some help with our homelessness, we tend to be able to deal with that. I think in Sheffield, the number of males that are coming to us are the males that are really, really complex. So they have a multitude of different issues, and you know, it's increased over COVID because of the reasons that I've spoken about. But it doesn't seem to be that the males that come to us, we can move on as quickly as some of the families. So it is difficult to say why. But you know, it's 40%, as Suzanne's just told me, are now single women. But it's difficult to know why we have more presenting to us. But I think that we can deal with families quicker, and we have more provision for families in the city. What we need to do, as Suzanne's talked about strategically, is look at this group and really, really pin down the reasons why single people are homeless in Sheffield, and why we're different to other cities, and why we can't prevent the homelessness. But also there's quite a culture as well in Sheffield and some other sort of northern cities where when you get to the age of sort of 18, people are coming to us and wanting council accommodation. And also there's other issues around the benefit caps, there's issues around bedroom tax. So there's all different issues that single people have to face that we're having to deal with on a day-to-day basis. I think that we're expecting that there may be an increase in families once evictions are allowed, but that's something that we've not seen in the past, so we don't know going forward.
Okay, Tim, I can see a hand up. Do you want to come in on that?
Yeah, it's just a general point about the complex rough sleeper community and how easy it is to move that community on. So it's not a case of being able to provide good accommodation and then being able to remove that person from the street, or get that person into drug treatment services or mental health services, or even a combination, and be able to remove that person from the street. The ASB situation involves a lot of people who have been homeless, who are now back in accommodation again. So it's other factors we're looking at across the city. So I'm involved in a trauma-informed working group looking at how do we deal with people who have experienced early life trauma in different areas of the city. So whether that's within the criminal justice system, or within homelessness, or within trafficking communities. How do we apply that learning to make sure that our services are more open to working with those issues, rather than ignoring them and let them be perpetuated to help homelessness go round in its ever depressing circles, really. So we can't ever look at, I think, in 1 year getting rid of all of that street activity, but we, I think, can look to have a plan in which we reduce it and make spaces for those people in different ways and in different places. And that's still a task that the city's got to do. The Changing Lives Fund, or Changing Lives idea, is part of that forward-looking solution.
Yeah, and just to add to what I was saying before, in other authorities, often people, they only work with people that are in priority need, as the law states. In Sheffield, we try and help everybody that comes to us. Anybody who's rough sleeping, they don't have to be in priority according to the law. If they're out there on the streets, we really, really want to help them. And that's something that other local authorities, particularly London authorities, are not doing. They only work with people that are in priority need. And I know that, I mean, Suzanne and I worked for Shelter in the past, and we used to send people to Sheffield from other cities, saying, go to Sheffield, we know that you'll get some help. And that's just an example of, you know, the reputation that Sheffield's got around homelessness.
That's always good to hear, that our sort of warm and welcoming reputation far extends beyond our boundaries. Councillor Baker, do you want to ask your question there, please?
Thank you, Chair. What a remarkable group of people. A number of us here who are on the committee now were on the committee before when we did street culture working group, and we met quite a few of you then, and we were amazed by what we found. And when we found a couple of gaps, it's somehow you filled them. As soon as you knew they were there, you filled them. And for a group of people to take such a major problem as COVID and turn it around and make it into an opportunity, my God, goodness, what amazing people you are. I'm really, really pleased to hear that you are using Housing First. I mean, I've discussed this with a couple of you in the past, the opportunities that brought, but you've again used this situation to bring this forward, which is amazing. One of the things I'd like to know, Chair, is what are the problems as you see them going forward? Some of the questions I'd got, you've answered going forward. And one of the things you've highlighted was what I was concerned about is people losing their tenancies as we come out of COVID. You're obviously aware of that and dealing with that. But what are your biggest concerns? The other thing is, one of the things that I think Tim hit on, but very discreetly, is one of the problems we've got are the characters themselves. There are some real characters out there. And I remember trying to persuade one person who was struggling in the winter when we had the fire station open, when the temperatures went down, to go to the fire station. And he refused point blank because he said, no, so-and-so is going to be there and he'll kill me. And that was his words. So he actually ran away from me in the end. So I wasn't able to help him further. But that is a problem when you put people in hotels and in bed and breakfast that you've obviously worked your way through and realised it's an issue. Another thing that seems to have been strengthened through this are the partnerships. There's always been some informal partnerships there, and you seem to have strengthened them yet again, which is absolutely an amazing achievement. So my question, Chair, is going forward, what's your biggest concern? What should we be looking at? Thank you.
Can I sort of start off on that? I would say my number one concern is the risk of being reactive rather than preventive. And that's really across all of us. I think we're all really committed to doing our best, and everyone has been. But my concern is that as there's more and more demand for services, we become more and more reactive rather than proactive. We can't deliver on the prevention in the way that we want to. And that's for everyone who might be affected by homelessness and the associated issues. So I think that is something to be mindful of. And it's certainly something that myself and Zoe are working through in terms of the in-house delivery of services. But it's also what I'm getting reflected back from providers as well. So, you know, people who might be providing supported housing or specialist services, that the needs are so complex and the environment at the moment is so difficult for people that it can be hard to always do what you would like to do for people and what they need. So I do think that is something we need to be aware of. Now, partly that's, myself and other senior managers have got to make sure we make the best use of the resources we do have. But we have to be mindful that there's only so much you can expect people to do, whether it's individual staff members, whether it's your volunteer services, the whole lot of it. But I think together we really are stronger, and I absolutely am confident on that. The other thing that I'm mostly concerned about, if I'm honest, because I'm an employee of the council, I'm here trying to do the best I can for the residents of Sheffield, is the impact of the pandemic and the associated issues on people who are experiencing them, who are the most vulnerable. And to be honest, for me, the big thing, we've talked about specialism, about supporting people for short and longer periods, is access to good, affordable move-on housing, so that people do have a home of choice that they can live in. Now, obviously, we're very ambitious as a council about setting out our own stock increase programme. So that's one of the avenues that can help people. But it's also about saying we've got to recognise that it's very, very hard for people to get their lives on track if they're not confident about where they're going to be living and it's a home they can stay in. I do also fully acknowledge what you said about for some of the individuals affected by these issues. And Tim talked about it, about trauma-informed practice, for example, that people have had issues for their whole lives, potentially, and they may not trust authority. They may have had problematic issues, either, with themselves, with peers, with family. They haven't got the same kind of support that other people might have. And for me, and it is difficult, that you've got to be in it for the long haul with people. You can't think it's going to fix and be sorted out in a very short period of time. Partly for me, that's helped because I've always felt that I can commission and deliver housing services, but that just isn't enough. It has got to be a whole person-centred approach. And I think that's the other thing, seeing everyone as individuals and working with them and treating them as adults, that they will have things, no matter how difficult it is, that they want to achieve. And they might not see it now, but it's about their future. So I do think that's something. And for me, that means you've got to have the right skills and experience of staff and agencies working together. Some people are very skilled at some aspects of working with people, but not at others. And I think, for me, I fully value, and we've got our voluntary sector partners here, that they can do things with people that I can't. And I wouldn't want to try and get involved in what they do. And I can do things that they can't. And it's about making sure that whole offer complements and makes sense to the people that are going to use those services. So really, Penny, I think I'm fearful that we're very, very strongly committed to working together, but there is a risk that we become overwhelmed because of the volume of need. I don't know if anyone, I know Daryl and Tim have got their hands raised, but I don't know if Zoe, you wanted to add anything from our point of view to that? No?
Sorry, I was talking and on mute then. I think I totally agree with what Suzanne was saying, and it's about having overwhelming services and not having that affordable, decent accommodation for people to move on to, and also the lack of available accommodation, even in something in like the private sector in the city, that doesn't give people a sustainable home going forward. And I think that is something that worries me. The other thing I think that worries me is that, as Suzanne said, as the numbers go up, our services have done so much work, and we've worked so much together, that we can continue to do that in a way that's really, really affects each individual person that we work with. And we don't become sort of flooded with people and not be able to cope, and those partnerships are lost. So that the partnerships will still be there, but if you have, the more work you have, the more diluted they become. So I think for me, it's about also learning from what we've done this year and making sure that we don't lose that. And I think that's really vitally important going forward.
Tim, do you want to jump in? I saw your hand first, and then we'll take Daryl.
Just a couple of points. One that Suzanne's already mentioned, and that is the sector tends to think about crisis and reaction as a first and foremost way of operating. We call it crisis bias, and actually what we need in the homeless sector in Sheffield is a front to back service, so that we're still working with formerly homeless people as they're moving into employment and supporting that movement into employment. And that takes organisation and determination. Left to itself, and we see it with people coming into the sector, people always want to work at the crisis point. Can we feed people? Can we give people socks? Can we give people shoes? And can we give them another sleeping bag? What we want is a thoroughly worked out program. What we've noticed during COVID is some of that middle sector of people moving away from homelessness have disappeared. And we suspect their mental health and their physical health has deteriorated during that time, and we'll be seeing them coming back round the circle, hopefully not going back right to the street again. The other thing is how we can invest in a city in prevention, proper prevention. I think over the decade, the figure I've got quoted is that if we look at the country supposedly spending 2% on GDP on social care, it hasn't done that. We've lost £136 billion investment over that 10 years. You can't lose £136 billion from a sector and expect prevention to have happened. So we really do need investment in prevention at younger ages, so before it ever gets to us. And that's really what I'd love to see the city talking about, more than anything else, probably.
Darryl?
I just wanted to make a couple of points really from a client's perspective. The sort of people we're dealing with don't really care which department we work for, which charity we're in, whether I work at Archer Project, I work at Ben Centre. They just, as much as we try, they see it as us and them, and they see it as they're a downtrodden community. So I just want to get across how important it is that we're all on the same page and that we're all holding these people's hands, because the instant somebody gets turned away, they're going to say, what's the point? I've tried in services, I got spat out again, and that's why I'm going to carry on living like I'm living. So I just kind of want to get that across, because we're sort of speaking about, like Suzanne, you mentioned about when we want it to be zero on the streets. It's not a nice thing to say, but we might never reach zero. But I just want to kind of say that if we're never going to reach zero, at least we want to get to a point where the people that are on the streets, they're not going to freeze to death, they're not going to starve, they're getting support, whether they're still there or not in 10 years, or whether they've moved around. We really need to just make sure they've got safety nets, which is what we're doing. But I just wanted to get that thing from their point of view over.
Tracy, I see your hand up there. You're on mute though.
Not like me to mute myself. I'm just mindful of, you know, just following on to what Darryl said then, you know, about people's perception. You're quite right, people, they're not, but nobody's bothered about who's delivering what. I think one of the things that we have been really good at, you know, the partners, and what has really been strengthened over COVID has been the communication and how we communicate with members of public. We were really fortunate to get some funding from Community Safety Partnership to ensure that we've got help us help messages going out consistently, sharing them stories, reassuring members of public, you know, that there were things they can do. I know we talk about funding, you know, funding's talked about a lot, but actually we've got a wealth of people in Sheffield who want to help but don't know how to, and I think that's where Help Us Help has really helped, being able to galvanise. You know, we've been, you know, like Darryl was saying, you know, the distribution. We would just put, you know, we heard about someone who might need a TV, put it out there, has anyone got one? You get one, you get a message. We've given out so many TVs and DVD players, and Darryl's got loads of, far too many DVDs, if any of you want them, you know, stacked at Ben Centre. So I think we not to underestimate, you know, instead of thinking it's just us as a council who's got to do it, you know, looking outside that, you know, and even past VC sector, you know, say that actually them service users, people who've used that have got something to offer, members at public have. So we've been we've worked, what has worked is the soup kitchens that used to operate from King Street even, you know, have for the first time, and they will tell you themselves, they used to themselves slag off treatment services. you know, support services, because they naively went out onto the street, you know, offering out food, like Tim said, you know, emergency food, wanting to do that direct. And they took the narrative, you know, listened to the narrative of what they've been told on the street. I'll share a blog with you after, but one of Women from Soup Kitchen said, I feel embarrassed now that I'm actually saying this, you know, because I believed everything that they said, and now they're involved in them conversations and networking with partners. They now understand, even, and she even feels better knowing on a Saturday night when she's giving someone some food, she knows that they're gonna, you know, she knows who they are, she knows it's going to get picked up. And I think people underestimate the power of communication, and we've got to keep being on it, being up, but also being honest as well. We haven't got infinite resources, you know, and everyone's working to the best they can. So we've got to keep real as well about this, you know, and not promise earth, because we can't do that. That was it. Sorry.
Yeah. No. Thank you very much for all those. It's important that we hear sort of a future view of where we need to be, as well as scrutinising what's happened over the short period of time that we've been looking at. So thanks for that. Councillor Hurst, you're next with your question, please.
Thank you. Yeah, I won't say this too hard, but I thought I will echo what Penny Baker said. I think what you've done in terms of you taking what's been a national crisis for most people and turning and actually getting something constructive done is it's really quite good to sort of sit through this. I'm thinking it's going to be a very quick question. I'm just thinking how to put it as tactfully as possible. It was a comment that somebody made, and I actually fully support that this should happen. But I think there is a challenge, if I heard it right. Somebody said they preferred not to go to, they didn't want to be made to go to town, particularly on a Saturday, because if they go to town, it's where the dealers will give them more drugs and the what have you. Now that does give us. I'm not even going to say it's a problem, because I think it's what we need to be doing is putting the welfare of these people absolutely first. But there is going to be a challenge that we will have to deal with if increasingly we spread people into residential neighbourhoods and offer them the help there. Actually, that may be the best place to do it, but I'm just wondering if anybody else can see, or any of the officers can see some challenges in that, and how we actually face those challenges. I'm honestly not being a NIMBY here, but I can just know what might happen. And I think we've got to be forewarned and forearmed about it.
Yeah, I think if I just start that, because I think it's a really good point. And we do need to work very closely with local communities to explain what we're doing and why we're doing it and how we can make sure community is supported. The reality is that people who've got drug and alcohol use issues are living out in neighbourhoods. So they don't all live in the town centre anyway. What they do is they'll go periodically. Their tenancies might fail, they go back on the street, they go through supported housing, that whole sort of cycle of despair that we've alluded to today. So they are there anyway. What we're trying to do is make sure that they're living in a very supported way, rather than being left for the crisis to happen and then we scoop them up again. But you're absolutely right. And the other thing to remember is that they meant very often these people are both perpetrators and victims of criminal behaviour as well. And that's the reality of their lives. So that's why that whole wraparound approach has got to be head on and acknowledge those things. So it is, and I know if Councillor Wood was here, he'd say, because I've had a lot of conversation with him about it, we've got to be very clear that these are adults who've got rights and responsibilities, and we're going to work with them around those. So it isn't just saying it's a free-for-all and we're going to put them in neighbourhoods and let it happen. It's actually about saying, if you're ready now to take those steps, this is what you need to be doing, and this is what we will do to help you. But I think it would be wrong to give the impression that people aren't living there anyway. They are. And you'll all know from your post bags that you deal with that there are issues about antisocial behaviour, criminal activity, that people very often they get cuckooed when they are vulnerable for these reasons. So I think what we're trying to do is say that's the reality. Let's deal with it head on in a more creative way that hopefully will be sustainable for them, because that does impact their neighbours. It impacts what the estate looks like, what it feels like to live there. So, but we're not shying away from it, Councillor Hurst. You're absolutely right to raise it. That's why the partnership is so important, and something I've been really heartened with. You know, it is kind of, there isn't an us and them between us and the police, for example. We're on board working together on this because, you know, one of their early fears, I'll be honest, was if you do disperse people, how are we going to manage it? Our city centre team are more experienced in dealing with these issues, but we don't want that to be what Sheffield City Centre's like, do we? So how do we work that together? I don't know if anyone else wants to chip in, but I do think it's a really good point.
I just so quickly leap in, because it's so really what you're saying, it's about getting the comms right from the beginning. Because I know everything you said is absolutely right. What I'm thinking of is all you need is the wrong letter in the local paper. Although, just a little quick aside, apparently at Staindrop Lodge, 1 or 2 people who live nearby actually are less disturbed because they found the weddings at the weekend was causing them more sleepless nights than all the homeless people who were staying there. And that was actually reported back to me by the police. Sorry, could resist that one.
Okay. Councillor Rivers, over to you.
Hello, it's more of actually a comment. I feel like I've had this meeting with the team, and first of all, I'd like to say thank you very much for all you've done and all you continue to do. In the beginning, we had in the Central Lab, we had really good few meetings, but one of the things that usually don't come out in reports like this is how much community cohesion both the philanthropy sector, the charities, and these officers have done. Within that, you've also recognized the holistic approach to the intersectional needs of the homeless individuals who have been placed within communities. And so as we sit here today, we all know that we need to have a good communication. And that was from the beginning of this, you've started having that with us, and that's really absolutely brilliant. I just wanted to say thank you for that communication that you had with us. And I think my worry was, and it was going to be a question, and I think many people asked you this anyway, my worry was the sustainability of not only the communication between partners and the multi-agency, but also sustainability of the work that it's so impressively that you've done and how that's going to continue. So, and you've answered that question already, so I don't expect you to answer it again and again. But one of the things that I wanted to say to the members here as well is the communications that we had and I had with this team from different areas and bringing community voice specifically in Broomhill and Shire Vale was really, and not only an eye-opener, but it showed that we really need to be on board and not just respond to 1 or 2 questions from one community member or one resident, but we need to think about the homeless people and the individuals who are being placed with communities are the most vulnerable, and that needs to be taken into account. And I think both Zoe, Suzanne and Tracy and Maxine, we've talked about how much we need to bring cohesion within communities, especially those who are going through difficulties, and this needs to continue after COVID. I don't know whether there's after COVID, but this needs to continue and be sustainable in terms of making sure that communities recognize the people who are being placed in that area are part of that community, and they should really embrace in supporting them. And thank you to the philanthropy sector as well. It's good to see you here. Thank you.
Okay, that was obviously more of a comment than question. So
yeah.
So that, which is great. That's fine. That's. But I'll just move on then to Councillor Sanger.
Thank you, Chair, and obviously thank you all the people who presented today. And clearly, you know, in challenging circumstances, we've clearly got a very good partnership working across the homeless sector. So I think my sort of I've sort of really got 2 questions. One is trying to understand some of what you were saying in terms of in terms of the rough sleepers, moving them into hotels, now putting in a wraparound service and then moving them on to independent living, and clearly that's what we want. And I think one of you suggested that we don't want to be using hotels in the long run. So understanding what sort of time scale we're going to move out of that accommodation. And I suppose my second question was really understanding the wider point that COVID has been quite unusual, both in terms of getting the rough sleepers off the streets, but also more importantly in terms of this temporary stoppage of evictions. And I think my big worry is in terms of the private rented sector when they're allowed again to try to evict tenants. What sort of numbers are we talking about, and how are we going to put in a multi sector approach to make sure that we can absorb that if that is the case? Because that seems to be the big worry I'm picking up from the housing sector across the country.
So who wants to take that one then?
Well, I can start if you like. Yeah, if that's all right. Yeah. So in terms of the moving on to independent living, is sort of asking for more about what it looks like, Andrew, or what we'd be doing.
No, it's well. I thought you said that some of the hotels that we were using, that wasn't a long-term plan to use those particular hotels.
Yeah. Okay. Yeah, it's not. So basically, we put that provision in very quickly. We're funded to use them up until the end of March. We're also using it for the winter plan for people that we didn't put through everyone in. But as we've said, anyone on the street now, we will offer them something and move them out very quickly. What we've recognised, and government have recognised as well as the sort of the COVID crisis, if you like, has continued, is that we may not be able to stop using them by the end of March. So we may need to carry that forward for a few months into the next year, but we're having those conversations at the moment. But it's not desirable for a hotel type provision to be where people are living. So some of the things we're doing is we're trying to, and again, because of all the lack of available options and things we had to do. So for example, we closed choice-based lettings for a period. We've now got it back up and running. What we had, so that means our supported housing's all full as well. So for some of the people we're talking about, supported housing is more appropriate. So what we're doing is prioritising people who are in fixed units of temporary accommodation and supported housing to move on to their permanent living arrangements as well, to free up space for people who might need supported housing. So it's a kind of chain of things. And what my aim is to get out of private hotel provision as soon as we can, but I want to be open and honest about when that might happen, because it's the worst thing to say it will be next week when it really won't be. And the other group that Zoe talked about that the council's decided to continue supporting are people with no recourse to public funds, because we don't want them on the street. Now, they don't have the same housing options as other people. So what we're doing is, because they can't access benefits and so forth. So what we're doing is we've got a small number of those individuals who are still in the hotels. I think we've got 9 at the moment, haven't we, Zoe? Zoe will tell me if I'm wrong. And what we're doing as a council is continuing to support them whilst they're working on their individual issues. So some of them, for example, it might be an asylum issue. Some of it might be an EU national who needs to get the settled status so they can move forward. So basically, we'll come out of that hotel provision as soon as we can, but we're going to be realistic about when that will be for each individual. And I think, you know, what we talked about as well with our winter plan, our ambition is to keep that going all year round. We don't want anyone to be on the street. And I know what Daryl's saying. Sometimes people are going to be on the street, but my ambition is there is always something that's on offer for everybody. And it's not saying they'll always take it up, but we want to be confident in the city there is something, there's a place of safety for everybody. So what we're talking to government about, aren't we, Zoe, is trying to make sure it's an all year plan, that everyone has something rather than it's a winter plan or it's a severe weather one. And the other issue you mentioned was about private rented provision. and that risk really that will increase as a reason why people become homeless. Now, what Zoe mentioned was one of the things we have got with our new duties as Homeless Reduction Act is that we do work with people earlier, so that we've got more notice that those things are going to happen. And therefore, what we've got is the opportunity is to say, can we help you stay there? So we've got homeless prevention funds, for example. We'll do negotiation with landlords. We'll try and work out what is that issue that can we help you stay where you are earlier than we've previously been able to do. If we can't do that, we will then help the person to plan their move rather than say it's at crisis point, because the worst thing for anyone is to go into a temporary accommodation provision. You know, actually, if you're going to need to move, let's try and make it a planned move. So it's that thing. So we're trying to encourage both individuals and partners who work with us. If there's an issue, if there's something coming up in someone's housing, let us know as soon as possible. And we've done quite a lot of successful negotiation, haven't we, Zoe, with private landlords to say, what is that issue? And can we put in some support to make that tenancy sustainable? Now, that isn't always going to work, but we do that. And our private rented scheme does work quite successfully to keep tenancies going for a long period of time. But the other thing that you might raise with me is when people are in private rented, the quality of that provision for people. So sometimes it's not everything we would want it to be. And we've got our private sector housing team as well, that if there's any provision we use for private rented, they check that. They check that A, the landlord's fit and proper, but B, that property is of sufficient quality. So it's kind of trying to push up the standard, but also make sure if there are issues in that private rented provision for people being able to stay there, we know about it as early as possible. That doesn't mean, you know, because people do have fewer rights in the private rented sector, that there will be occasions where people, and again, if they've been accruing housing debt during that time, that the landlord may be reluctant for that to continue. And the other thing which affects landlords is they might not be able to keep that property themselves. You know, if they've had problems on a shortfall of rent and they can't pay for that property, if it's been a buy-to-let, for example, there isn't an easy answer. I won't pretend there is one. And it's a risk that we're anticipating.
Can I just add to that we're doing some intensive work at the moment with the DWP, because we've noticed the correlation between employment and homelessness. So we're looking at doing some work with them to put some of our workers in the job centres and link each person that comes to us really early on with a job coach, so that basically we can look at employment and homelessness together. Because homeless prevention, if we've got our homeless prevention heads on, that means that if somebody can't stay in the home for affordability, we link them to a job coach, get them into work, then they're going to be able to afford to live in their property. So that's some really intensive work we're doing. And also for fast tracking people's income maximisation and benefits, so that if it is a financial issue, we can get in there really quickly and make sure that people have got all the money that they're entitled to. And that includes working with our own rents team and others in registered providers, so that we can put an alert on as soon as possible that somebody's having difficulty with their housing. We're also doing that with our duty to refer. So as part of the Homeless Reduction Act, one of the things in there was about certain organisations have got a duty to refer to us as soon as they know there's any issue around homelessness. And we have done a lot of work with probation, with the hospitals, DWP, so a lot of agencies around the city, so that they can just alert us immediately, so that we can try and have some success, whether it's negotiation with mortgage providers or landlords, or there could be something really, really small but makes a huge difference to someone staying where they are. So and that's why we use our prevention fund as we do.
Yeah, that's helpful. I mean, I think what I was concerned about was, you know, furlough is going to come to an end. this temporary ban on removing on court cases in terms of eviction is going to come to an end, and all of a sudden the caseload is going to go up. And it's great that there's all this work being done in preparation. I just wanted an idea of what sort of a surge it could be, and was there any way to make sure that the partnership was ready for it. And it sounds as if you're expecting it and you're doing some work, but just some idea in terms of the scale of it would be helpful.
I really think that it's difficult to say in numbers, because we might be able to look at our own accommodation and say, well, we know that this many people are having problems, and I would hope that we'd solve that in the homeless prevention case, but we don't know how many people out there really are having mortgage difficulties. And I know that we try and work with partners around the city to inform us, social workers, mass team and all of that. But I think to put a number and a figure on it at this moment in time would be really difficult. I don't know what you think, Suzanne.
The thing I'd add is that we do work closely with our own Revs and Benefits department. So they're aware of people who are claiming benefits to help and who are in private sector housing. And what we've done in previous years, though, is we've targeted particular individuals who may be affected by welfare changes or circumstances. So it may be that we can do more in that arena as well. But I would agree with Zoe, we wouldn't absolutely know, but we will explore all of the areas and avenues where people might know information that can help us. So again, our private sector housing team colleagues, they always tell us as well about issues or areas of concern, and again, we've got really good relationships with Citizens Advice, for example, so the Advice Network, who keep us informed with their intelligence about what the issues are, so that it can either be for individuals or pockets areas. So we do have good intelligence about where there is a lot of private sector housing, and we can tie that up with areas of deprivation, for example, where we know that there's those issues.
Thank you, Chair. Thanks.
That's okay. I haven't had anyone else flag to ask a question, so I'll just give you a last chance in case I've missed anybody. No. Okay. So just to say then, thank you to you all for coming, for sacrificing your evening to give us that information and your point of view. It's really heartening to hear the great work that's been done, and hopefully, as others have said, that we can find a way to keep that sustained into the future on an ongoing basis. We've got a great story to tell here in Sheffield, and it's down to the hard work that you guys are doing on the ground on behalf of some of our most vulnerable residents. So thank you very much for your time and the work you're doing.
Thank you.
And I'll just join everyone else clapping with the clapping. So you're free to leave now. Councillors, in terms of the report, it was just to note and discuss. There's not any sort of recommendations to put to a vote or anything like that. So I'll just move on to the next item, which is the work plan.
Chair,
yeah.
I'm sorry, I'm interrupting. And
No,
I can't think of anything myself, but the remarkable officers and volunteers that have just left us, and we've all said thank you to them, and we all believe that. Is there anything we can report back to anybody and say, this group of people have been doing a wonderful thing and we want to recognise it? Could we sort of ask the Lord Mayor to say anything? Could we put it to Cabinet? I don't know. I'm looking for ideas, but I really do feel quite strongly that this is one occasion that all those people have put so much effort out for the people who are really struggling. And good if we could say thank you.
We record our thanks in the minutes.
We do that, Peter.
We do that naturally, but no one reads the minutes except for us.
Just to jump in and interrupt. But I'd agree with Penny here, because I've got to say that the scrutinies and everything that I've attended have varied from sometimes being disappointed in officers. Generally, I think they do a good job. But actually that one was, I thought, I always thought it was humbling that what they have done, and also the clear both knowledge and dedication they have. So let's be honest, one of the most unpopular groups of people to help. I think, if we can think of something else to do, I'll support Penny. I'm not going to make a habit of this, Penny, I hate to say.
I'm not going to say that one, Chair. I mean, I don't know. We could perhaps write to the leader of the council saying that this has happened and we're really pleased with it, and then make it an open letter. I don't know. I'm really looking for ideas.
Yeah, Emily, I can see your hand. Do you want to?
I was just going to suggest a letter to the leader and the chief executive, and copying in the exec director and cabinet member for this area might be an option.
Put out a press release thanking them.
Well, we could do both. We could make it an open letter. That would be, then it would do exactly as Peter said, it would be a press release.
I suppose, I guess, what's the ultimate aim of it? If it's something for them as individuals, I think it would probably be better coming from the Lord Mayor as the first citizen saying thanks for the work for everyone else, rather than the leader and chief exec as sort of.
Yeah, I agree, Ben. I think with the Lord Mayor, if the Lord Mayor could say something for next council meeting, it'd be great. That'd be the ideal.
Yeah.
Especially seeing as it's a budget council, I suppose.
Yeah, I agree.
Yeah.
Could we ask you, Chair, if you would approach the Lord Mayor, please?
I can do that. Before we sign me up to that, Councillor Murphy's got a hand up, although she's in the dark and.
It's on similar. Sorry, yeah, it's on similar lines. The Lord Mayor does have his own awards that he or she can give to people, so they could be recipients of a Lord Mayor's award. I think Kate's still on as hosting the meeting. I'm sure if we spoke to Kate about that, she could arrange something via the Lord Mayor.
Okay, so I'm happy to take that away, have a conversation with Kate and others that may be necessary, and work something out along those lines. I think that's a great idea. Thanks, Penny. Okay, is there anything else on that item? No. Right, so yeah, so if we move to the draft work programme, which I think is fairly straightforward, in our next meeting that's scheduled is the 18th of March, and that's the sort of statutory duty of looking at the Safer and Sustainable Communities Partnership Board annual report. What's not in there is the other meeting that we discussed and agreed, and we just need to finalise a date for that. So if you leave me to take that away with Emily, and we'll circulate a date before too long. I aim to have it in place by the end of next week for you, just so we've got good notice of it. Okay, and then with that, I think that's the end of the meeting.
Well done.
Yeah, see you all on the 18th of March for our next meeting, and obviously at full council in between. Keep safe and enjoy the rest of your evening.
Thanks, cheers, well done.
Bye.